Hello, my name is Russell Myers. There are a lot of things about my campaign that I'll be covering at some point, but people mostly want to hear about policy. So let's jump straight into that. Um, I also want to say I mentioned that I have another channel called Issues Unite. I am going to be maintaining that channel. This channel is going to be about my platform, my policies, and that's it. My other channel is commentary on current events. Please subscribe to that channel, and I go into a lot of detail on that channel on different things. I mentioned that I am very much in favor of universal health care. Now, it can be challenging to decide what policies to approach first in a campaign. I chose this topic because it is a popular one, which has a lot of support. Over 80% of Americans across party lines support universal health care, which many are currently calling Medicare for all. As I have disclosed, I am a nurse. I have been an advocate for universal health care since before becoming a nurse, ever since encountering universal health care in the U.S. Army when stationed in Germany in between 1986 and 1990. Our biggest problem in realizing universal health care is the lack of support at the highest level of our government. We get lots of political doublespeak, with many at the top of major parties distorting universal health care into access to affordable care or just access to health care. One big thing about that is who decides what is affordable? Access to what care? Most often, the people who are deciding what is affordable are in the millionaire bracket and can afford a lot more than you or I can. Elected officials already have universal health care, even though they are in the six-figure income bracket. So these are the people that are deciding what is affordable. So let me say it up front. This is an absolute promise that if I am elected, I will pursue the enactment of universal health care with extreme energy. No games, no twisted words, no twisted meanings. There are a number of reasons universal health care is the best system for the greatest number of people. First and foremost is lower overhead cost. Under corporate insurance, a huge portion of your premiums pays for things which have nothing to do with medical care. You pay for corporate executive pay and bonuses. You pay for shareholder dividends. You pay for stock buybacks. You pay for advertising, which alone means tens of millions of dollars per day across all media: print, telephone, internet, direct mail, television, radio, you name it. You pay for promotional materials. You pay for insurance agent premium commissions. You pay for doctors' offices, clinics, and hospitals having to keep and submit numerous copies of your records, specialists who do nothing but negotiate with insurance companies, each insurance company having separate criteria and forms for every procedure and test. All the above accounts for 40 to 60% of your insurance premium before the insurance company denies your claim. If done properly, with universal health care, you would have no deductible. Many Americans, myself included, see no benefit to having health insurance because we have to pay thousands of dollars a year in insurance premiums, only to then be told we have to pay thousands more out of pocket before the insurance company pays a single penny. Then they only pay a percentage, and we have to pay the rest, while still paying your insurance premiums. The remaining portion is still enough to cause millions of Americans to declare bankruptcy every year, even with insurance coverage. I have a friend with brain cancer. She is terrified of missing the payment on an insurance premium, knowing they will drop her coverage like a rock. She's not able to work. So, and yet she's afraid of not making an insurance payment. This happens all the time. You can be hospitalized, possibly in a coma, and your insurance will drop your policy if you miss a payment. Not able to work because of illness or injury? Too bad. Denials of claims are common. I once worked as a subcontractor for insurance companies, processing requests for advanced imaging like MRIs and CTs. At first, it was great. I was there when the ACA began. Then the insurance companies began changing criteria for approvals and the system for processing requests, making it far more difficult for studies to be approved. The number of denials for claims went through the roof. I quit shortly after that. My ethics would not allow me to continue. Of course, my quitting made no difference. But for me, my conscience, I had to go with my conscience. Universal health care may include a copayment, though in most countries that copayment is lower than the copayments that we typically pay here. In some countries, there's no copayment at all. Because corporations can charge more money for each policy, medical care in this country does not cover dental care or vision care or hearing aids. Often, so how is it that some parts of our bodies which require care by medical practitioners are not considered medical care? Universal health care would cover all of the above. When we cut out all of the fluff, bureaucracy, and pork included in insurance premiums, which have nothing to do with medical care, we would get a lot more medical care for less cost. This is not theory, this is fact. I've had debates on the subject too many times to mention, and those who oppose universal health care could never offer a single example of how privatized insurance is more efficient in any way. Universal health care would also be much simpler. One billing system, one set of evidence-based criteria. No double billing, no higher premiums for existing conditions, no denial of valid claims, no deductibles, no bankruptcies due to medical bills. I will state that most countries with universal health care do have supplemental insurance to cover things not covered by basic care. There would be no requirement for your doctor or clinic to accept the government payment system. So, in most cases, you're going to get to choose your doctor unless your doctor does not, accept the universal health care system. Some people fear that universal health care would mean longer wait times to see a doctor or have surgeries, etc. Honestly, yes, it would, at least at first. That's because many people who have had no true access to care would then be able to get that care. But that would only happen for a while, and then it would return to normal. You know what? We've already been through that once, when the ACA first began. Yet it was such a small difference that nobody even remembers it now. Any such increased wait times would be temporary. And we can adapt our medical system further to make it more efficient and less costly for many things. Of course, the difficulty is coming up against insurance companies with their billions in lobbying money, tens of thousands of lawyers, and sitting elected officials in their back pockets. So let's say that universal health care does not pass with one or two attempts. Then what can we do? The answer is make the existing system so difficult and so costly for insurance companies that they themselves beg for universal health care. Some examples of things to that end could be: make a requirement that 80 to 85% of insurance company revenue be paid out in medical care coverage. Revenue, not profits, revenue. Prohibit higher premiums for existing conditions. Prohibit canceling a policy while a person is incapacitated in any way. Cap deductibles at no more than $1,000 per person, $2,000 per family. Limit premiums to 10% of income of worker's primary job, 5% of income below $40,000. And let me say that again, of your primary job. Most people that work multiple jobs don't do so permanently. They try to work two jobs. I've done this. You work multiple jobs for a short period of time to try to get ahead enough so that you can stop working multiple jobs. So this would be based on your primary job. Remove all lifetime coverage limits. Converge medical, dental, vision, and hearing into single plans. Mandate single billing. Your providers all submit their claims to your insurance carrier. Your carrier sends one single bill to you for what remains. Medicaid would become a supplement to insurance instead of the other way around. Insurance companies could not force a chronic care or disabled person back or onto Medicare, Medicaid because the patient became too expensive or inconvenient to the insurance company. Medicaid could cover what insurance did not. Instead of having Medicaid with supplemental insurance, we turn that around. These are only a few examples of efforts which would make continuing the current corporate insurance system so onerous that insurance companies would ultimately surrender the fight to suppress the fight for universal health care. I think I really worded that badly, but you get the point. Couple this with other policies meant to limit corporate influence on our government, and this is a fight which can be won. It will not be easy, but we can do it. And these are just examples of ways in which it may take a creative approach, but we can do it. All right, so please share this video, talk about these subjects, because we can absolutely do this. All right, thank you very much for watching. Again, my name is Russell Myers. I'm running as an independent for U.S. President for 2024. And talk to your friends about this. All right, thank you, and have a good day.